This is Dr. Kathryn Dao reporting for Room Now. So I just attended the FDA updates at the ACR 2020 virtual conference coverage for the ACR convergence. And so if you have been living under a rock or you're just not listening to the news, I'm going to update you on what the FDA changes have been made in 2019-2020 since the last ACR meeting. And this has been a big year for approvals for pediatric rheumatology, which is great because, therapeutics have been so limited for our peds colleagues. So what the FDA did was they approved for patients with juvenile idiopathic arthritis over the age of 2, golimumab. So this was approved on September 29th, 2020, and they approved IV golimumab for both JIA as well as psoriatic arthritis in children. In addition to that, on September 25th, 2020, they also approved tofacitinib for polyarticular JIA. Now, the tofacitinib dose is dose based on weight. This is where you have to take out your calculators and calculate what you should give. But actually, there's an easier way to do that. You can look under the websites for the FDA, or you can actually go to the drug manufacturer's website. But here's the dosing. Tofacitinib dosing for JIA between 10 to 20 kilograms is 3.2 milligrams BID. And if the child is 20 to 40 kilograms, is 4 milligrams BID. And if the child is more than 40 kilograms, you dose them just like you would an adult. All right, the other labeling changes. So they did remove a warning label for belimumab. So they took out mortality as one of the warnings. And this is based on recent updates, post-marketing research and reporting. They found that the risk for mortality in patients who have been receiving it for lupus was no difference compared to placebo. So they did remove that label. In addition, they did add to abatacept that angioedema and hypersensitivity reactions can occur, both in the sub-Q formulation as in and also in the IV formulation. So angioedema and hypersensitivity reactions, that's added for abatacept. In addition to that, baricitinib, they did add hypersensitivity reaction as part of the label now for that. And then for gabapentin and pregabalin, what we've been prescribing for our patients who have fibromyalgia, they added respiratory depression as one of the warnings, okay? So this is with or without hydrocodone or other CNS suppressants. Gabapentin and pregabalin can increase the risk for respiratory depression. And then in terms of approvals for adult, so in June, canakinumab was approved for adult onset Still's disease. And then in May of 2020, ixekizumab for non-radiographic axial spondyloarthritis, and that's at 80 milligrams every 4 weeks. And then they also approved nintedanib for progressive ILD. So that's actually a big win, especially for patients who have interstitial lung disease that's been progressive from autoimmune and connective tissue disease. And then they also did mention that belimumab for their label, they removed that Black and African American label where may not be as efficacious. That was removed. And then for secukinumab, they did get the secukinumab approval for non-radiographic axial spondyloarthritis as well as ankylosing spondylitis at the higher dose. So that's going to change my practice actually, because my patients with AS, they actually do better when you use 300 milligrams every 4 weeks. So now you can do it without having to relabel them, right? And then there's also several biosimilars that are approved, two for adalimumab, and they're basically word salad, adalimumab AFZB and adalimumab FKJP. And then infliximab generic AXXQ and rituximab generic ABBS. So you'll be able to access generics for your patients. It might be a little bit more cost effective. So those are all the changes for the FDA in this 2020 meeting. I hope you're having a great day. Follow me on Twitter. And then you can also access information about what I just spoken about on the FDA website. This is Dr. Kathryn Dao reporting for Room Now.